Morning, everyone. My name is Saanie Sulley. Today, I'll be briefly discussing the outcome of my research on housing difficulties and respiratory presentations or hospitalizations in the United States. In today's presentations, I'll be briefly talking about the background and the rationale behind why this research is important. I'll be talking about the objectives and the goals of this research. I'll be talking about the methodologies utilized in this research. I'll talk about the results that were found in these studies, and as well as the conclusions and recommendations for next steps, or how we can be able to utilize this research to inform some of the care processes. It is estimated about 17 per 10,000 people at a particular point in time may be homeless from a study in 2017. Now, this does not include the inadequate housing or even overt lack of housing and individuals living with other families, friends, or even living in situations where they do not have a long-term housing opportunities. Now, diverse factors including policies, socioeconomic and mental health policies across various regions in the United States have been shown to directly or indirectly impact these health outcome presentations. And studies have also shown or established the relationship between the direct health impactors or the health outcomes in these conditions, both respiratory and otherwise, based on the lack of housing, given the exposure these populations have over a long period of time. Now, the direct and indirect presentations can be or has been established to be directly related to the higher cost of care, and it's also related to the severity and mortality risks associated with such presentations across the board. The objectives of this study includes examining the impact of housing and respiratory diseases and disorders hospitalizations in the United States. It also includes examining the prevalence of housing difficulties and respiratory diseases by race and ethnicity. It also includes an understanding of the severity or evaluation of the severity and mortality risk at presentation, further stratified by region, race, and age group. Finally, another objective of this study is to understand the variances in ED or emergency service utilization among patients that do have housing difficulties compared to those without housing difficulties in the United States. Study methodology. The National Inpatient Sample Dataset between 2016 and 2018 was utilized in this study. The National Inpatient Sample Data is available through the Healthcare Cost and Utilization Project, also known as HCUP. Now, the HCUP is sponsored by the Health Resource and Service Administration of the United States. Primary and secondary international classification of disease, or also known as ICD, 10 codes were utilized in identifying housing difficulties in the United States. Specifically, Z59 codes were utilized in this study. Patients with respiratory-related diagnoses using major diagnostic categories, specifically MDC-04, was utilized as an identifying factor for respiratory presentations. A chi-square test for the relationship between respiratory presentations, mortality, sex, severity at presentations, region was utilized in this study. Study results. A total of 1,095,880 presentations, both primary and secondary, were identified meeting the inclusion criteria of housing difficulties. Now, of these individuals, a total of 71,895 were identified as having a respiratory presentation. Of those populations, the analysis were conducted of individuals with respiratory presentations plus housing difficulties and respiratory presentations without any housing difficulties. This results graph shows extreme mortality rate per 10,000 presentations among patients with and without any housing difficulties. As we can see here, the highest rate presentation per 10,000 cases were among individuals 75 plus, followed by individuals at 65 to 74 years old at 1,171 per 10,000 presentations. We also see the same trend or trajectory among patients 55 to 64 downward. Now, one interesting factor we should note here in these findings is the presentation rate among 25 to 34 and 35 to 44. We see here among 25 to 34 a rate of 549 per 10,000 presentations among individuals with housing difficulties. Now, among the same populations between 25 to 34, we are seeing a 508 presentations per 10,000 cases. Now, the same applies to 34 to 44. We can see there is a higher rate presentations among individuals with housing difficulties between 35 to 44 compared to those without housing difficulties at the same stage. Now, among the much younger population of 18 to 24, we see a minor variance in individuals with housing difficulties at 415 per 10,000 presentations, and individuals without housing difficulties at 424 per 10,000 presentations. Extreme loss of function rate among patients with and without housing difficulties by age group. As shown in this graph, you'll see the population less than 18 years old and with housing difficulties have a significantly higher rate of presentations with respiratory conditions in the hospital. This means higher risk of hospitalization and long-term inpatient care. Same trend when looking at individuals between 18 to 24. We are seeing a rate of presentation of about 1,382 compared to 1,261 per 10,000 presentations among this patient population. Among patients between 25 to 34, there is also a higher presentation among patients with housing difficulties at a rate of 1,328 and 1,295 per 10,000 presentations. When we go further looking at age between 35 to 44, we are seeing again a higher rate of presentations for respiratory conditions among patients with indicated housing difficulties at a rate of 1,303 cases or cases per presentation per 10,000 presentations compared to 1,251 per 10,000 presentations. We have a little change in dynamics when we look at age 45 to 54. Here we are looking at a higher rate presentations for individuals without any indication of housing difficulties, and same applies to the age range between 55 to 64, whereby we see a higher rate presentations for individuals without housing difficulties at a rate of 1,663 per 10,000 presentations and 1,416 for individuals with housing difficulties at a 10,000 rate. Now, when we further look at individuals between 65 to 74, we see the similar trajectory or the similar rate that we are seeing between 45 to 64. We see that the rate among individuals without housing difficulties is higher at a rate of 1,835 per 10,000 presentations, and we see a rate for individuals with housing difficulties for the age presentation of 65 to 74 at a rate of 1,530 per 10,000 presentations. Now, among older population, much older population, 75 plus, we are seeing individuals with housing difficulties have a higher presentation of 1,879 per 10,000 presentations compared to 1,842. So there is varying dynamics of how housing impacts respiratory presentation. And as we go through the pandemic and as we understand the various impactors or various socioeconomic dynamics that exacerbate presentations, it is imperative to look at these individual dynamics and allocate resources or tailor training programs or tailor educational programs to decrease this burden of presentations across the board. Extreme mortality rates among the population with respiratory diseases or presentations with and without housing difficulties shows an interesting dynamics among classification when classified by race and ethnicity. Here we see among the white Caucasian populations, the rate of presentations among individuals without housing difficulties is much higher at a rate of 1,166 per 10,000 presentations compared to 722 per 10,000 presentations among the white populations. When we look at the black population, we are looking at among individuals without any housing difficulties, a rate of 952 per 10,000 presentations compared to a rate of 644 per 10,000 presentations among individuals with housing difficulties. When we further look at the Hispanic population, we are seeing a rate among individuals without any housing difficulties at 860 compared to 718 per 10,000 presentations among populations with housing difficulties. When we further look at the Asian or Pacific Islander population, we are seeing a rate of 1,233 per 10,000 presentations compared to 1,098 per 10,000 presentations among individuals with housing difficulties. A further analysis among patients identified as Native American have a much higher rate of respiratory presentations among individuals with housing difficulties labeled in blue. Here we see the individuals with housing difficulties have a rate of 888 per 10,000 cases or per 10,000 presentations compared to 877 per 10,000 presentations. When we further look, individuals that identify as other, we see a higher rate presentations for individuals with housing difficulties at a rate of 1,030 per 10,000 presentations compared to individuals without any housing difficulties at a rate of 949 per 10,000 presentations. As we see this dynamic, and this study shows that there is a varying degree to which housing affects population by race. We see a varying dynamics and varying relationship between respiratory presentations and race and ethnicity. Extreme loss of function per 10,000 presentations stratified by individuals with and without housing difficulties and by race and ethnicity. Here we see among the white or Caucasian population, the rate of presentation is 1,634 per 10,000 cases and compared to 1,396 per 10,000 cases among individuals with housing difficulties. Now, among individuals without housing difficulties in the black population, we see a rate of 1,558 compared to individuals with housing difficulties at a rate of 1,243. Further analysis among the Hispanic population, we see that there is a rate of 1,399 compared to a rate of 1,375 per 10,000 presentations among the Hispanic populations. Now, when we further look at the Asian and Pacific Islander population, we see quite a variance. Among individuals without housing difficulties, we see a rate of 1,693. Among individuals with housing difficulties, we see a rate of 2,197, the highest among all races and ethnicity when further stratification of the data. We see also a higher trajectory of respiratory presentations among individuals with housing difficulties in the Native American population, as well as population that identify as other. In the Native American population, we see a rate of 1,509 and 1,716 per 10,000 presentations among Native American populations. Among the population that identify as other, we see among individuals with housing difficulties a rate of 1,680 compared to 1,491 per 10,000 presentations. We see a variance just as we look at the mortality we saw in mortality risk. we see a variance in more in severity risk at presentations, of course, among the Asian and Pacific Islander population, Native American population, and individuals that classify as other. Now, the variance among the Hispanic population is not that significant in terms of their presentation, but there is indeed some minor variances. And even among the white and black, further stratification by region, as we will see later on, there is a variance and differences among each and every one of these populations. In these slides, we'll be looking at extreme mortality rate classified by rural urban demographics by individuals with and without housing difficulties. Here we see on the top the regions of non-metropolitan or non-micropolitan, therefore not small and non-large urban centers, have a much higher rate among individuals with housing difficulties. In terms of extreme mortality risk at presentation, we see a higher presentations among populations in not metropolitan or micropolitan counties. Now, in micropolitan counties or micropolitan regions, we are seeing a much higher likelihood or extreme mortality risk at presentations for individuals with housing difficulties at a rate of 1,134 per 10,000 presentations compared to 1,074 per 10,000 presentations among patients without housing difficulties. Now, when we go further in counties with areas between 50,000 to 249,000 or 250,000 population areas, we are seeing that the rate presentation or respiratory presentations among individuals without housing difficulties is significantly higher compared to presentations among individuals with housing difficulties at a rate of 1,140 compared to 630 per 10,000 presentations. When we look at counties between 250,000 to a million, there is again the trajectory is similar to what we saw between areas with 50,000 to 250,000 population size. Among areas between 250 to 1 million, we are seeing a higher rate among individuals without housing risk in terms of presentation compared to individuals with housing risk at a rate of 1,132 compared to 737 per 10,000 presentations. Among fringe counties or metro areas with greater than 1 million population size, we see a rate of 1,122 compared to 550 per 10,000 presentations. A similar observation can be made with central counties greater than 1 million population size. We see a significantly lower respiratory presentations among individuals without housing difficulties compared to those with housing difficulties. For the evaluation of the data, looking at extreme loss of function among the patients with and without housing difficulties by rural-urban classification, we see a similar trend as we've seen with extreme mortality risk at presentation. We see here not metropolitan or micropolitan counties, we see a rate of 1,588 compared to a rate of 1,400 per 10,000 presentations, where in this case we are seeing a higher rate presentation in not micro or metropolitan areas among individuals with housing difficulties, higher presentations among individuals with housing difficulties compared to individuals without housing difficulties. When we further look at micropolitan areas or rural areas, we are seeing a much higher presentations among individuals with housing difficulties compared to individuals without housing difficulties. Therefore, respiratory presentations or inpatient respiratory presentation or even hospitalizations among individuals with housing difficulties is much higher at a rate of 1,728 compared to 1,587 per 10,000 presentations. Now, when we look at areas with about 50,000 to 250,000 population size, we are seeing a reverse dynamic compared to what we've seen so far, with a higher presentations among individuals without any housing difficulties at a rate of 1,657 compared to a rate of 1,463. per 10,000 presentations or respiratory presentations. Now, when we look at counties or regions of between 250,000 to a million, we are seeing a similar trajectory compared to what we've seen before in metro areas between 50 to 250,000 at a rate of 1,641 among patients or without any housing difficulties, compared to 1,467 among patients with housing difficulties. Now, when we go further to fringe counties or areas with metro areas greater than or equal to a million population, we are seeing a much higher respiratory representations for individuals without any housing difficulties compared to areas with housing difficulties. When we go further in central counties with areas of a million plus population sizes, we see the rate of respiratory presentations among individuals without any housing difficulties indicated in red here compared to patients with housing difficulties is much significant in terms of the number of presentations is higher among individuals without any indicated housing difficulties. For the analysis of the data by sex, we can see that extreme mortality risk among patients with housing difficulties and respiratory presentations, we see some minor variances compared to comparing males and females. Here we see for males there is about 789 compared to 1,176 rate presentations per 10,000 cases or per 10,000 presentations or respiratory presentations. Among females, we are seeing much smaller, so the risk is much higher. Males compared to females, we see about 576 rate presentation per 10,000 cases compared to the higher presentations among individuals without any housing difficulties at 1,031 per 10,000 presentations. So in this case, we are seeing males tend to have tend to present with housing difficulties, and males tend to present also with a higher extreme mortality risk compared to the general populations. Looking at the data further by extreme loss of function by sex, we see that in males we are seeing the rate presentation is similar to what we've seen in extreme severity risk at presentation, with about housing difficulties or individuals without housing difficulties having a rate of 1,712 compared to 1,483 per 10,000 presentations. We also see among females about 1,502 compared to 1,169 per 10,000 presentations among each and every one of these populations. So again, what we see here is similar to what we saw earlier in extreme mortality risk being higher in males compared to females. A review of the loss of function by region shows quite an interesting dynamic. Here we see quite a varied presentation in the New England region in terms of presentations among patients with housing difficulties and respiratory presentations being 1,128 compared to individuals without any housing difficulties 1,480 per 10,000 presentations. Now we go further and looking at the West South Central region of the United States, we see the housing difficulties is at 1,597 compared to individuals without housing difficulties 1,604. We'll further look here in the mountain region, we see the largest variance in terms of individuals with housing difficulties having a 1,815 rate presentation compared to individuals without any housing difficulties 1,691 per 10,000 presentations. So in this case, we are seeing a significant variance in the mountain region compared to most part of the United States, but we are also seeing a very close association, at least close relationship in terms of the rate in the West South Central, but also in other regions such as the West North Central of the United States. This graph shows there is variance across the country in terms of this presentation. Now, the direct and indirect impact of these housing policies in each and every one of these communities or regions may be impacting such presentations. Now, the conclusions of this study is that this study shows that severity risk and mortality risk at presentations varies by region. It varies by race and ethnicity, with higher in the mountain and Pacific regions of the United States in terms of mortality and severity risk. We also see that there is an imperative need for developing strategies that is specifically targeted toward local needs and local understanding of ways to address this issue. Given the various dynamic and various presentation rates, as well as the various factors that could be impacting these presentations, there needs to be a concerted effort at addressing the innate or the basic aspect that is impacting such presentations. Now, these the study shows that there is a lot of room for us to be able to improve the approaches that we take in improving the rate in curbing the rate at which such presentations occur across the country.